Well, no one wants braces, but they are a fact of life for many children and adults. But there are ways to ease the pain and treatment time. Today, Dr. Alan Petersen, with our sponsor, Rollins and Petersen Orthodontics, is here to tell us about Insignia. I guess that's a new thing that's sort of hitting the orthodontics offices, huh?
It sure is, and it's just been out about a year. We try to stay abreast of all the latest technology, and this is one that I think is really exciting for patients.
All right, well, go ahead and explain it to us. I understand you brought a video, and sometimes pictures help a little bit.
I did. I think seeing the video will help understand a little bit better.
Okay.
So what we're going to see here is this patient came in. We take extensive records. They're scanned into a computer, and then it creates a 3D model.
Okay.
Here we're going to see the orthodontist who gets to adjust each tooth individually to come up with your ideal smile. Once those are it's determined, we actually produce custom appliances. In other words, each bracket is milled specifically for that patient.
Okay.
So it's just for you. Then they send a little tray that helps place the brackets on your teeth in a specific position to achieve what we had produced in the computer.
Okay.
What this means for you is that we have predictable results. We make sure the teeth end up exactly where we wanted to finish them. It also ends up, as you'll see, with a beautiful result here in a short amount of time.
So I'm sure there's a lot of people out there that have had braces, or their children have had braces. I've had braces. So how is it different than sort of the old school way of, you know, I feel like I had braces for years.
Right, that's a great question. Well, again, it comes down to this bracket that's made just for you, just for your teeth. And until now, we've used what we call standard brackets. So going across the mouth, they're all the same. Now, this may sound, you know, maybe a little bit far-fetched, but as we get to that specific bracket made just for you, what that means, your tooth, each tooth is moving to its final position from the very first appointment.
Okay.
So we don't have to go back and reposition and change things. Overall, this means less treatment time for you, fewer visits to the orthodontist, and you get to have that perfect individualized smile.
Now, what is the time frame on this? How long does it typically take? I'm sure everybody is different, but about?
Right. Well, we're looking at average treatment times in braces of about 18 months.
Okay.
With Insignia, we can pull that down to 14 months on average.
Okay.
And even less depending on the case. And for the average patient coming in less to the office, I know our schedules are busy, so that makes quite an impact on the lives of our patients.
Because these brackets are just for us, you know, is it uncomfortable? Is it like your typical, you know, braces where they tighten it or move things around?
We have the same kind of appointments where we do tighten.
Okay.
But it's no more uncomfortable. In fact, it might be a little bit more so.
Okay.
Because those brackets are made just for you. So we don't have parts that are sticking out into the cheek as far. And then again, with the fewer appointments and fewer adjustments, that means, again, more comfort, because each adjustment does cause some discomfort.
Right. You know, we've been thinking about getting braces for our son. He's 13. What is a good age? How do you know when to bring your children in for the braces?
That's an excellent question. Usually, the American Association of Orthodontists recommends by age 7.
By age 7?
Yes, and we can see some things at that age that maybe we can prevent problems later on down the road. Generally, at Rollins and Petersen, we don't put on braces until most of the permanent teeth are in. So between ages 11 to 13, and everyone is different. But generally, your dentist will give you a good idea and indication of when would be a good time to see the orthodontist.
Right. I have 3 boys, and our dentist is saying, oh, this was going to be a problem. Oh, this one's not going to be too bad. So how is it financially? Again, I'm sure everybody is different, but is the cost pretty much the same, or do you guys have some great plans to help?
The cost is coming down, and that's just because we're able to incorporate some of these newer technologies.
Right.
But there's always interest-free financing, and we work with insurances and make it work for you.
Okay, great. Well, the new technology, I mean, if you could get it done faster and have it look better and feel better, I'm sure the parents and the children will be all for that. Thumbs up.
Absolutely, yes.
Okay, great. Well, thank you for coming on Sonoran Living.
It's nice to hear.
We want to let everybody know how they can go ahead and get a hold of you. It's Rollins and Petersen Orthodontics, and they are at 480-924-2880, or you can go to arizonabraces.com, and they have a couple of locations. You can reach them out in Gilbert. They're also out in Mesa, in Queen Creek, and even for those folks living out in Globe. Rollins Petersen, we want to mention, is a sponsor of Sonoran Living Live, and also a 10% discount off of orthodontic treatments. Right. All you have to do is go ahead and mention Sonoran Living. Sounds great. All right, there you go. Rollins and Petersen Orthodontics. You can reach them at 480-924-2880. And again, ArizonaBraces.com.